Hello, this is a presentation providing an overview of the Strengthening Systems for North Carolina Children, or SYNC for short. Before I go any further, I would like to acknowledge our funders, the Centers for Disease Control and Prevention. Through the CDC, we're provided a cooperative agreement opportunity to implement SYNC. Hi, my name is Belinda-Rose Young, and I am the project director for SYNC. Later on, you'll hear from my colleague, Meghan Chua, who is the program manager for SYNC. Both Meghan and I are housed at the UNC Injury Prevention Research Center. The other members of our core team are Kristen Hasmiller-Leach and Becky Nauman, both housed at the UNC Gilligan School of Global Public Health, Vishy Jagannathan at Rural Opportunity Institute, and Ingrid Busada at the North Carolina Department of Health and Human Services. So what was the purpose of SYNC? Well, the goal of SYNC overall is to continue strengthening North Carolina's understanding of community-level determinants of adverse childhood experiences, or what we call ACEs. We focus this work on communities that bear a disproportionate burden of ACEs and other drivers of health by documenting the complexities of communities through a systems thinking approach, and with a specific systems thinking tool that we call cause loop diagram, or CLD for short. So what is SYNC? Well, SYNC provides multi-sector community teams a training and technical assistance opportunity to help them develop and use the cause loop diagram, or again, CLD for short, that is tailored to the conditions of their community. So the CLD depicts the systems that influence ACEs-related factors within their community that are most relevant to their context. Our team provides training, resources, and other supports along the way, along with follow-up technical assistance to help the teams not only learn how to use CLDs, but to implement them to prevent and mitigate ACEs. Teams use their CLDs to develop an action plan with steps they prioritize using points of high leverage in their community that they've identified. The CLD also helps the community teams identify and engage additional community partners in their ACEs prevention work. So why did we develop SYNC with these components? Well, we recognized the need for SYNC through other work that we had done with past communities. As we provided other training and capacity building, we saw a need for communities to better understand their local systems so that they could make impactful, long-lasting, and positive change to ACEs and their specific community context. We also recognize that the communities need more time to do this sort of deeper systems work, and that we weren't offering enough time in past opportunities. We also saw that they needed more support and technical assistance along the way. Now that you have more of an understanding about SYNC and what it is, I'm going to turn it over to Meghan Chua to talk to us more about systems thinking and the curriculum that we implemented.
Okay, so let's jump into some level setting about systems and systems thinking before jumping into more details about the SYNC curriculum. So what is a system? A system is a collection of parts that interact with each other to form an interdependent whole. So here we see several examples of systems. We have a watch in the first picture. All the individual parts come together to help us tell time. The human body is a system. It has lots of organs and other parts that function together to help us stay alive. The family is a system with individuals who take on different roles to help the family unit as a whole thrive and grow. And finally, the transportation system has lots of different components that function to help us move around a region in which we live and get things done, like getting to work or to activities for entertainment and social connections. So this is a system story anecdote used to talk about feedbacks, which are key features of systems, which we will describe in more detail later when we introduce the causal loop diagram. So this story is over a century old, so the facts of what happened in Delhi may differ, but it is a great tool to see the importance of understanding the system as a whole and the story behind the trends over time, rather than focusing on linear relationships. So this story describes a scheme during British colonial rule of India, where the British government wanted to control the population of venomous cobras in Delhi. They observed over time a large number of cobras in the city, so the government decided to offer a bounty to be paid for every dead cobra brought to officials. The policy initially appeared to be successful. People were claiming their bounties, and the number of cobras in the city appeared to decrease. But even though initially fewer cobras were being seen in the city, the number of dead cobras being brought to the officials continued rising, and the government continued to pay the bounty for people bringing in dead captured cobras. So this graph helps us see the trend in cobra numbers between 1900 and 1906. So as you can see, there was a dip here, and then it started to rise again by 1904. So despite the British efforts to control the cobra population, what actually happened is that people started to breed cobras for money because of the bounty. And once they figured out what was going on, the British government scrapped the program, which led people to set their cobras free now that there wasn't a financial incentive. And the wild cobra population actually increased. So let's pretend that they had a systems thinking team come in and say, okay, what's your problematic trend? And they say cobras. And we say, okay, let's draw what we believe happened over time. And so they draw over time the population of cobras and say, okay, we had a bunch, it started to go down and then rebounded higher than ever over the past few years. And they start discussing factors that shaped that trend. What is important to understand is what is happening to this over time. And someone says, I don't know, we put an incentive program in place to reduce the cobra population. That's all I know about it. And they said, well, that can't be all that was happening that shaped the trend. If that was it, we would have seen likely a continued steady decline. And that policy action alone doesn't really help us understand this trend where it starts to go down and then it starts creeping back up. Then somebody else with a different perspective on the system, maybe a community member, might say, okay, let me tell you what I see. At first, I saw people go up in the city to try to catch cobras and make money off of them. And that eventually subsided. But you know what else I saw? There was a whole industry of cobra breeders that popped up to make money off of them, breed them and turn them in for steady income. And someone else says, well, I can tell you what I saw from the government side. People in the government got mad. I know leaders started hearing what was going on, and there were several heated meetings, and they decided to abandon the incentive program. And the community member says, yeah, when that happened, people let the remaining cobras go, creating a bigger problem than what we started with. So understanding these stories of what is happening over time is so important to understand the full dynamics driving these trends and can ultimately tell us more about where to intervene. And this requires different perspectives observing different pieces of the problem. And a systems thinking approach offers a way to better understand those complex and dynamic trends that we observe. Okay, so now that was a broad overview of the purpose of sync and some level setting on systems thinking. Now we're going to move into more detail about the curriculum that we walk communities through. So this project is, of course, focused on ACEs. We work with North Carolina communities with a high ACEs burden. So ACEs are a very difficult measure to measure. So we look at proxy measures for ACEs. Communities who are interested, we ask them about community level risk factors for ACEs, like access to resources and economic opportunities, rates of poverty or food or housing insecurity, and intergenerational trauma. And it's a best fit for communities who are interested in bringing multiple sectors together and using a systems thinking perspective for ACEs prevention. So we work with communities one at a time because it is a very in-depth project. We work with a community team, which is structured as 10 to 25 people representing a variety of sectors and perspectives in the community. Excuse me. And then the core team is a subset of that community team. So 2 to 5 people from the core team, from the community team, who are more involved in every step of the causal loop diagramming process, which I will talk about later. And then the core team is also responsible for keeping the community team engaged and working towards their goals outside of the sync workshops. And then the team lead is one person from the core team. So these are all subsets here. And the team lead is their group facilitator. So they do any coordination and logistics outside of the sync workshops. And they are also responsible for keeping the community team engaged and working towards their goals to a more involved degree than the core team. So this group as a whole is participating in sync, and this is a long-term group. They continue to work together on the action plan that comes out of sync after the workshops have ended, and they're likely meeting separately outside of the workshops while the workshops are going on. So this is an approximate overview of what the curriculum activities look like timeline-wise. They're a combination of in-person full-day workshops and virtual sessions that are 1 to 2 hours. The core team is more involved outside of workshops. They have an additional full-day workshop there, and they're meeting with us, the facilitators, as needed for any questions or problem solving outside of workshops. And then after completing the curriculum, they have a year of technical assistance, which Belinda's already talked about a bit, and she'll talk about a bit more later. TA is where they are implementing the action plan that they create in the final workshop. So during the project, teams are creating a causal loop diagram, which is a visual aid showing how components of a system are interrelated. And we use the causal loop diagram as a way to zoom out on the larger dynamics and mechanisms generating ACEs and understand how factors and components interact and function together to create a system. So this is where the team is coming together. People are bringing their different perspectives from their different sectors and creating this diagram, zooming out and looking at their overall community and what's influencing ACEs. Then we zoom in and plan strategically around areas of high leverage to focus action efforts and how to modify components of a system to address a problem or make change. So this is where you're using the causal loop diagram to plan strategically. And then we develop the causal loop diagram using group model building to engage multiple sectors and perspectives in the community to elicit their perceptions about what's shaping the problem. What are the benefits of a CLD? Systems thinking and causal loop diagramming can allow partners to view the larger system they are embedded within and support cross-sector collaboration, and also support development of a common understanding and shared language. So that was that zooming out that I was talking about on the previous slide. And then it can also help in strategic planning to better understand complexity and how systems behave and support identification of high impact leverage points and opportunities for action. So that's that zooming in that I was talking about on the previous slide. This project is framed around shared risk and protective factors. So protective factors decrease the likelihood of experiencing an adverse outcome. So there are conditions, characteristics, and influences that can decrease likelihood of experiencing ACEs, for example, and they're buffer against risk, and they are at the core of asset-based or strengths-based prevention strategies. And then risk factors increase the likelihood of experiencing an adverse outcome. So they can increase the likelihood that a person will experience ACEs and are contributing factors to, but might not. They are contributing factors, but they might not be direct causes. And risk factors are not determinative. So not everybody who is identified as at risk will experience ACEs. And we call these shared risk and protective factors because they're linked to multiple health and quality of life outcomes, including ACEs. Okay, so at the beginning of the curriculum, we start by making small CLDs. And to do this, one of our first activities is this trends over time activity, where participants look at data of trends over time in their community. And they sketch out these trends and then they write what they think is influencing those trends. So that's what you see here in this photo on the left. These are what participants made brainstorming what they think is influencing those trends. And then everybody shares out what they've put in on their graph, and then we cluster them by theme, which is why you see them organized in groups here. And then participants go around after everyone's shared out and put dots on 1 or 2 themes that they want to focus on. And we arrive at a theme or themes that the group agrees on that they will use to frame their CLDs and anchor their discussions as they create their CLDs in the next step. So for this team, their focus was family stability and family violence. Our first community focused on mental health, including access to care, substance misuse, including access to care, and hope and happiness. So after they've done those trends over time activities, we move on to creating small CLDs where the team divides into small groups based on what area they want to focus on. And they're working on their own, but they have a facilitator with them to help guide them through making the CLDs. And we, of course, train them before the components of a CLD and how to create one. So like this one here is focused on access to substance use disorder services. And I'm actually going to go to the next slide for this, which is on kid suspension and equity. So on this left photo here, you can see they were brainstorming what factors are influencing kid suspension and equity. And then they put this together into a small causal loop diagram of how these factors are interacting together to influence kid suspension activity. What are the interactions between these factors? And then here's another one around economic stability. So as you can see, it can really vary what they end up focusing on, even all like around this theme of family stability. So then once they have those small CLDs, that's where we end in workshop 1. And then the next day they work on synthesizing those CLDs together into a larger CLD. We explore how they fit together. So this is that team's full CLD, one of 2 full CLDs that they made. And this one is centered around family stability and family violence. And then just because this was so big, they ended up dividing it into a few smaller sub-CLDs. So this is FSV, this is still the family stability and family violence. This is just a subset of the previous slide focused on poverty and ability to work. So all of this is on that previous slide I was showing as well. And then they also had one around services. And then this was a separate CLD around suspension in schools. So that's where they land with the CLD creation. Then we move on to leverage points. Leverage points are places within a system where a shift can produce a big change in everything. Excuse me. So for example, low-income housing is a leverage point. An absence of low-income housing without job creation can perpetuate a negative cycle of increasing unemployment and welfare costs. So this is that same family stability and family violence services portion of their CLD. Then this next slide is that CLD with leverage points. These orange circles here are the leverage points that they added. So they ended up adding leverage points around community centers and spaces for kids, which they think would influence community violence, mental health, mental wellness, and non-problematic substance use, and social and emotional learning. They've got a leverage point around motivating community actions towards equity and healing and reaching community leaders. And this is influencing normalization of violence and movement towards healing and racial equity as opposed to criminalization. And then they have this third leverage point here about coordination across programs and creating a community of practice. And just for the sake of time, I'm not going to go into too much detail about this one. So once they've identified those leverage points, they move on to evidence-based action planning. So to start off, we align the variables in their CLD with the CDC defined shared risk and protective factors. So this column here on the left are the variables that they identified in their CLD. And then we look through the CDC's resources on shared risk and protective factors and identify what fits, like where their CLD variables align with the CDC identified shared risk and protective factors. And of course, it's not a perfect match, but just to get a general idea of where it fits. And we do this because the CDC has a lot of resources about evidence-based ACEs prevention. So we use this as a starting point for them to start brainstorming action ideas. So these are the 3 resources that they start off with. We give them a whole list of resources, but just so that it's not overwhelming, they start off with these 3 as they're brainstorming. Then we, for strategic planning, they're thinking through these high leverage action ideas. So this top picture is a full photo of the action ideas that they brainstormed. And then I've put screenshots below just so you can see a little bit closer. So they have one around community centers, action ideas around equity and DEI, community engagement, coordination across programs, workforce and professional development. And all of these here are their ideas around those areas. So once they've done that brainstorming, they move on to creating an action plan. And to do this, we start off with this impact matrix activity on the left. I know it's hard to see, but the x-axis is changeability, level of changeability, and then the y-axis is level of importance. And those action ideas that they brainstormed on the previous slide, they think through where do they fit on level of importance and level of changeability. So anything here in high importance and high changeability, oops, this quadrant, oh, sorry. Anything here in this quadrant is the optimal place to start. It's high importance, high changeability. Then they work on creating an action plan using those ideas. So they're starting with these high importance, high changeability ideas as they develop this action plan. And as you can see here, it's got like the specific action step, who's going to be responsible for implementing, overall timeline, what resources are needed for this step. So this is where they land at the end of the workshops. So teams have, these are the three main outputs. Of course, they're not the only outputs, but the causal loop diagram, the team charter, which I didn't talk about as much, but that's just to help them think through who they are as a team, like prepare their mission statement, things that are going to help them be productive as they work on this project and help like avoid any potential conflict before it happens. And then their work plan, which I just talked about. Okay, so curriculum challenges and lessons learned. A positive of sync is how in-depth we can go with communities, but it does mean that we can only work with one team at a time. Well, there's overlap with the TA, but for the curriculum, we can only work with one team at a time. And we've had several strong teams that applied, and it can be difficult to choose one per year. So we've had to focus on teams that are well set up for success, like their readiness, as well as, of course, their ACEs burden and how they compare with other counties. We are being intentional about working with a diversity of counties over all 3 years. So counties spread across the state with different challenges, different cultural climate, different demographics. And then another takeaway we've had is that the perspectives who are in the room will be the ones that shape the CLD. So if somebody isn't able to attend, their ideas will not initially end up on the CLD, which is why it's important to have a lot of sectors and perspectives and types of life experience present. We've incorporated partner interviews where team members interview external people in the community to get their perspectives on the CLD, which helps for people who aren't able to make the time commitment. And then another challenge is that this kind of ties into that perspectives point, but another challenge is that a lot of the activities are based around large group discussion, which can be very effective at capturing a variety of perspectives, but it can at times lead to team members who are quieter or less comfortable sharing in a large group from voicing their thoughts or people dominating a conversation. So we ended up incorporating more varied ways for team members to contribute ideas, like small group discussions or using slips of paper to write down action ideas, which was that photo that I just showed a couple slides ago. And then each participant writes down their ideas for action steps and shares out, which helps to ensure that everybody gets a chance to share out. And then we found that sustainability is most successful when the community team integrates the sync into their regular work roles. And then in year one, we had a hybrid setup where people who weren't able to attend in person could participate over Zoom. And the interactive nature of group model building and the conversation that came out of the CLD made it difficult for remote participants to fully integrate into the conversation. So in the next year, we made it fully in person and encourage participants to interview those who couldn't attend in person for their external partner interviews and workshop 2 that I was talking about earlier. Okay, so I am going to pass it on to Belinda now to talk about our technical assistance portion.
So after teams complete the workshops, they then move into a year of technical assistance. So in this section, I'll describe the phase. So with regards to technical assistance, there's three main portions I'll go over in this section, namely the format of the TA, the outputs from the TA, and some lessons learned. So the purpose of the technical assistance portion was to assist community teams in implementing the CLD. So each team now has a wonderful, complex visual of the factors and the feedback loops that are influencing ACEs within their community, which is great. They also have identified a list of high leverage points. But now it's time for us to help the teams identify clear strategies to see movements on their high leverage points and to provide technical assistance when they run into stuck points, because they will run into some sticky points. So as you mentioned before, the length of the TA session is a year. This really gives teams the opportunity to do a lot of trial and error, to make additional connections and partnerships that are needed to really implement this work in, and hopefully build it into some of their other work plans and shared community visions across multiple sort of organizations. So contrasting with the in-person workshops, as Megan just talked about, we did TA remotely. So it was all remote, it was all virtual, and it really consisted of quarterly calls. And we did that just to give teams enough time to be able to implement things in between, to really test things out, see what was working, what was not working, and to be able to come back to us and get some TA. But we also provided a host of other touch points, such as ad hoc training calls around some platforms we'll talk about in a moment, some ad hoc support calls with things that would be coming up before the next quarterly call, and also some document reviews, things like reviewing some grant applications and giving some insights. And again, I'll talk about this more in a moment. So the goals overall for the TA was to implement, there's several. One was to implement a work plan and revise as needed. As Megan said, they would have gone through a work plan during the workshop, but naturally there need to be revisions as they're rolling this out, helping them move past, sticking points, planning more for sustainability. This is really imperative. So as Megan said before, making sure that things were now being incorporated back into their work roles and making sure there's alignment between what they're doing at work and what they wanted to do through sync, increasing other sort of skills, which I'll talk about in a moment, and just providing tailored support. Each county is going to be different. As Megan mentioned, we made sure to recruit diverse counties. They all look different, and so the support is going to look a little bit different. So in order for us to prepare for the year of technical assistance, there were two main drivers, if you will, that led to what was included in the quarterly calls, in the ad hoc calls, et cetera. One was a team-driven. One aspect was team-driven. So at the conclusion of the workshops, we implemented focus groups about a month or 2 months after to really gain some insights from the team where they're already flourishing and where they might feel stuck, so that we can roll that into our plans for the TA. We also implement a host of questionnaires before and after each TA session, just to know where the team is and help them, again, prepare for the next quarterly call. There's also some predetermined topics. So we, at UNC and with our DHHS partners have been collaboratively leading several academies over the past 7 years. And we've just learned some topics that are going to be needed for multi-sector teams to implement work in their counties. So our first county conducted technical assistance with us between September 22 to September 2023. And some of their tailored needs was that they came to us and said, we really want to know how to effectively use our opioid settlement funds. We know that we have some dollars coming down the pike, and we see how it relates to what we're wanting to do through sync. And so we wanted to be very strategic about how to use those funds and how to approach higher ups in our county to get a portion of those funds so that we can sustain our work, so that sync becomes more integrated into language of what we're doing. They also were interested in developing a grant to provide additional dollars and support to bring on, a personnel to really help them manage this work because everyone on the majority, I should say, of people on the county team, the community team, have day-to-day jobs. And so having some additional support really helps them with sustaining the work. With regards to our second county, they started technical assistance with us in October 2023 and will continue into October 2024. So some of their tailored needs was really garnering more support with county leadership, namely commissioners. That was a roadblock that they were facing. And so to alleviate that, we provided quite a bit of guidance and are continuing to provide guidance on how to approach those leaders, different initiatives and events that can be done to really bring those leaders on board for them to see movement in some of their high leverage points that they identified. Also, providing resources and talking points to help them really, to others, validate pieces. We've seen that, across several different teams and several different teams and other projects that not everyone buys into ACEs and believes in it. And so that's um, a natural thing, support that some teams are going to need. With regards to our technical assistance outputs, there are several outputs that come from each team. The first I have listed here is a team charter. There's an asterisk there. For our first county, they did not complete a team charter during the workshop, so it's something that they needed to do within their technical assistance year. So for them, that was a product. For both counties overall, a revised work plan and sustainability plan action items, and I'll give you a visual of what that kind of looks like in a moment. As I mentioned earlier, we also make sure that our team has the skills that they need that are within our wheelhouse to be able to train on. And one of them is Kumu. So as you would have seen the lovely images that Meghan showed earlier, we provide cost loop diagrams for them, but over time, there's going to be a need to update that as policies change, as new organizations or companies come into the area or things sort of shift. That's going to shift the system. And so there's going to be a need to update those cost loop diagrams. Also, the ability to create effective pitches to those within the community and to be able to communicate in longer form content. Also on the importance of understanding ACEs and the importance of using a systems thinking lens, which necessitates bringing multiple sectors, multiple organizations together in order to reduce ACEs. We also provide external resources. So one is forthcoming, that's peer mentorship. I'll talk about that a little bit more in the next step section, excuse me, and also connection to Rural Opportunity Institute. So as I mentioned at the top of this overview, Vishy Jagannathan, who's based at ROI, has done this work. So she and her co-CEO have put together a cost loop diagram and have been rolling it out in their rural area for a number of years. So the ability to connect our teams who are also in typically more rural counties to a county that's been doing this for a number of years is invaluable. So on the next slide, we see a picture of the team charter. And I really wanted to emphasize the different components here. As Meghan was saying earlier, it's going to be invaluable as you're rolling this out, as you're talking to other members of your community to tell them about what you're doing, as you're trying to convince your boss for time to be able to work on this, to really have clarity on who you are as an entity, as this think group, what your goals are, both short-term and long-term, and how to work together as a group. So as you can see in section B, things like communication preferences. What's the best way to get a hold of me? What's the best way for me to get a hold of you? What are our strengths? So as we're thinking about strategies to see movement on those high leverage points, Where am I stronger? Where are you stronger? Who has the role of delegation? Who has the role of making the minutes for each meeting? Those sort of nuances that sometimes we don't think about before we start to jump in. And so we wanted to make sure that there was a charter in place that was clearly laid out for the teams to be able to use. On the next slide, we'll see a visual from one of our county's work plans. And so here you'll see in the first column, one of the action steps that they wanted to achieve. So again, these action steps are to see movement on a particular leverage point. So they have action steps, and then they have who is going to be a part of that action step. So who's going to be involved, people responsible, and the time frame that's going to take. And then what's nice about this work plan is that it's a shared document. So it allows each member of the community team to come in, put their notes, their progress updates, and as they have more meetings, be able to update in real time their work plan. So it's nice to have that shared visual. On the next slide, we'll see a snapshot from the sustainability plan. So our sustainability plan that we've used both in SYNC and other training opportunities has several elements, 7 in total. And this is just one of the elements. So this is not the whole plan. This is just a snapshot. So one of the elements here is element 5, effective operations and building solid infrastructure. And so as you can see here, these are some considerations, some guiding questions and thoughts for teams to consider as they are making their plan, as they're updating their plan, both their work plan, but also planning for sustainability overall. So do we have written roles and responsibilities? You know, is that done within the team charter? Are we having regular meetings? Do we have a process for documenting decisions? So those sorts of guiding questions are really going to be helpful for teams. With regards to some of the lessons learned, there are 2 main lessons learned that's come out of our first 3 years providing TA, or first 2 years, excuse me, providing TA. And that is the importance of incorporating team charter into the workshops. As I mentioned before, we did not do that with our first county. That was a lesson learned that we quickly rectified when we had our second county. And the reason why it's so important is when you have people in the room as you're going through this group model building process, as you're building this cause loop diagram, as you know, spirits are high, as people are excited, it's important to make sure that there's clarity before leaving the room. What are our next steps? Who's doing what? And you know, who's documenting this, that, and the other. So that what is our mission overall? That was really important to have. The next was more so for us as a group of facilitators who are equally as passionate about this work to go at the community team's pace. You know, we are eager and ready to be able to support. We value so much these communities giving up of their time to be able to reduce ACEs. We have a shared goal, both as facilitators and counties, to see reduction in their communities and with regards to ACEs. And so that can actually lead to excitement, right? And so it was important for us to be able to make sure that the teams are structured well, and to be able to march at the pace that they, you know, can go. And so that was a lesson learned for us. So this overview right now is being recorded in the summer of 2024. So we're currently in year 3 of a 5-year project. And so in this next section, I'll provide an overview of what we aim to accomplish in the next 2 years to build on our successful project. So we will be bringing on our 3rd and final community team this fall. Very excited about that. And with regards to that, the natural next step is to get communities talking to each other. They're at different phases, but there's a wealth of information and knowledge that can be shared across teams. So we are also very much interested in working towards planning some peer support opportunities, some cross-team meetings, to make sure that teams have the opportunity to get to know each other now. And even after the funding is done, our project funding, if there's never another funding opportunity, that the counties have each other as a support. And you have a cohort where you're kind of going through this together. You can call up someone else from one or two other counties and troubleshoot with them. This is especially important as people shift roles within a county. If someone leaves to move somewhere else, it's really important that they not only, yes, have access to us as facilitators, but to each other, the boots on the ground. The last major next step is with regards to our communications and dissemination. So we have launched a project newsletter that has been going on throughout 2024. We will continue to have quarterly updates to that newsletter. You are watching this on our website. And so if you're interested in receiving quarterly newsletter updates during the time period of this funding opportunity, please send us a message and let us know, and we'll add you to that. We are also in the process of developing a train the trainer manual. We really want to make sure that all of our knowledge makes it into a document so that other counties can be able to implement it within themselves or with a neighboring county. We want to make sure that sync lives on. If there's never another funding opportunity, we're not just the holders of this information, but really it's available to anyone who's interested in getting a multi-sector team together to reduce ACEs within their county. There's also several publications that will be coming from our project. So the first one is a systematic literature review. So we were very much interested in understanding what other communities or counties or states have done to reduce ACEs within their communities using a systems thinking approach, specifically cause loop diagram. And so we're in the process, as of the time of this recording, in the process of wrapping up that review and hoping to publish within the next year. We're also drafting an evaluation manuscript or evaluation paper. This is an evaluation of the entire sync program. And so this is going to be really helpful and really pairs well with the Train the Trainer manual. It'll be really exciting for other counties and other potential funders to be able to see the utility and just the impactful nature of this project. The last is our CLD paper, and what this entails is looking across CLDs for all three counties to see what are the common drivers, what are the common factors, are there common leverage points, what are the common themes, and where do they differ? And so hopefully this will be a resource that also pairs well with the Train the Trainer manual, where any county that's interested in taking this on can see what sort of commonalities there are and be able to think about whether or not that resonates with their current geographic locale and their political climate and all that. So hopefully it could be a starting point for future teams that are interested in this. Well, thank you so much for giving us your time today. We hope that you're as excited as we are about the Sync project. Again, please do not hesitate to reach out to us if you have any questions about the project or would like to be added to our quarterly newsletter listserv. Thank you, and we wish you all the best in mitigating ACEs in your area.